So I started in November with Dr. Jack Cruz, and he basically, I knew I wanted to start something with oral health, but he kind of told me, floss is bullshit, everything is bullshit.
Huh?
Basically,
Great.
everything we've been told, everything we've
Everything
been
you
told,
called your whole life, right?
yeah, is
Yep.
yes. And so I subsequently I joined his Patreon, which is the best $5 a month you
That
will
you've ever seen in life. Okay.
ever. And it's great because there's a lot of he obviously isn't the author of all of the studies that he talks about, but he's really good
Right.
at synthesizing and saying, hey, this is the story, and these are the hyperlinks that I think you should like almost like a trail. Like I think you should check out these hyperlinks and see why
Right.
I feel this
Cool.
way.
Super cool.
Yes, he also, just one last thing, he paid from his own pocket a lot of Soviet studies
Oh, wow.
to be translated to English because the Soviets have always been,
Ahead
uh,
of the time.
yeah,
With
yes,
certain things, right? So yeah, yeah.
yeah,
We have to take, all the good pieces from everything we can. And that's always the best way for us to learn because I feel like even though we're like America, I feel like we're so behind sometimes. Like we're so fast to just be on the big farmer trail and we don't ever look for anything. So it's kind of crazy how everything's going on right now. But
yes.
yeah,
As a society, we definitely love panaceas. We love, quick get, lose 30
yeah.
pounds by
Quick
tomorrow.
fix, give me an injection. I don't want to diet. I don't want to exercise. Yeah, it's a little scary. And they give medicine for everything. I mean, in Australia, they do a sleep study before they'll even diagnose for ADHD, which is pretty amazing.
Yeah,
Because it's
that's
all the same symptoms. So it's pretty amazing what goes on. And I always look at where the money's coming from, and that's kind of where it's always driven from.
yeah,
So not so wonderful because that's healthcare, right? But we're trying to make a difference. So this is really cool. I'm excited that you're doing this.
beautiful. Yeah.
Not like a podcast queen or anything. Like I don't love doing these things, but I figured I would do it for you.
Listen, I detest being on camera. I detest
Yeah, me
it.
too. I don't
You
love it.
can
It's
look at
not my
like
thing.
I hide from the camera. I've always done it. So just a little bit of the origin story. My daughter falls at the park and the dentist was like, "Okay, don't let it turn into a cavity." And that was it. Like I paid a pretty penny to be told
Yeah.
that. And I was like, "Wow, what does this even mean?" Like I lost it and then and again, I'm grateful for that woman because she pushed me in a direction that otherwise I would have never taken. Yeah, I read every
Just
book
listened to your doctor and done whatever the doctor said, and that would have been that. Yeah. It's
and I
I
decided to and
your
then
journey.
right, and then the other piece is definitely my nephew's
Yeah.
transformation, which
Nice.
I was talking to my niece or my younger sister just yesterday, and she's like, "We have our sweet little Marcos back," and I was like, "Oh, isn't it crazy?"
He's such a great kid. Like he is such a nice kid. And he was so motivated. Like, he'd come in and he was like, he was really trying to make sure everything was done. He was like probably one of the sweetest boys I've worked with, especially in his age group,
Right.
because they can be a little snarky. And I mean, I have two boys, so I can definitely relate. But he was like so regimented and he did really well. I was super proud of him. And he was so excited with his results. So
Yeah, like I say, the proof is in the pudding, and
yep.
that it is delicious. It's like
Yeah, it's
he
amazing.
looks amazing. He was, everybody thinks, oh, you're just a teen, you're hormonal, you're going through it,
Yeah,
but 180,
yeah,
180.
it's so exciting. So
Yes.
exciting.
So, in case anybody doesn't know you, just give us a little, background, how you ended up where you're doing now.
Yeah, so my name is Joanne. I am one of the owners of MyAware with my partner Brittany Sierra Murphy. So I've been a dental hygienist for I don't even know how many years. I don't even want to date myself, but probably over 30 years.
Wow.
And always in the mouth, always, we always were taking classes, we're always learning, we're always trying to do the best for our patients. And I was at a job for a really long time. And then I got this offer to work for a company that did appliances for sleep apnea. And I didn't even know what a sleep apnea was at that time. So I started going on the interviews, and it was a little grueling. I was like a little overwhelmed. I was like, oh my gosh, this is a lot. And I started training with Chase Dental Sleep Care, which only did appliance therapy. So instead of the CPAP machine, it gave people another option because lots of people won't wear the CPAP machine. I think there's like a 16% compliance rate with the CPAP machine,
Wow. Yeah.
which is really bad when you need that. So as I started learning about it, I went to courses with him and I saw one man speak. And so I always shout him out because he's probably the most amazing person, Dr. Ben Moralia. And I started down that rabbit hole. And he started explaining things while we were at this class. And I don't think I ever looked back. I never looked at dentistry the same again. Then I started taking my functional classes, and I met Brittany, and she had a company in Connecticut that I started working with. And then we thought, wow, wouldn't this be cool to bring to New York? Because that's where I lived. And we opened up Myo Air. And 6 months later, I found out I'm moving to Florida. So now I'm like, okay, I just started a business.
Yeah.
And now I do. And we came down to Florida, and we met a
As a
whole bunch.
Florida native, welcome.
Thank you. It's wonderful. Like I haven't looked back. I mean, I miss my people. I definitely do, but it's been amazing down here. It's really nice. And my kids are down here, and I just want to be with my family. So it's a much different life for us, which is really nice. And I opened up Myo Air, and I started meeting these amazing airway health professionals like Dr. Stagg and Dr. Patel and Dr. Janice Schwibner. And there's just so many great people. But they're far spread. So you really kind of have to find them in the mix.
Right.
And here we are, saving lives and helping adults sleep and helping children function and not be on the struggle bus. And it's been an amazing journey. And I've never loved doing anything more in my whole life than I
Yes.
love when I see somebody tell me, you saved my kid. And I just that is, to me, there's no amount of money that like actually could even matter after
Yeah. How
that.
fulfilling. Yeah.
Yeah, it's just huge. It's absolutely huge. It makes me teary. It's
But
crazy.
no, it's amazing because so I read Dr. Liao's 6 Foot Tiger, 3 Foot Cage, and I was like, I actually had the privilege of speaking to him yesterday, and I was like,
Exciting.
I'm the one with the problem. Like, yes, my daughter's 3 and we have plenty of time and we can, I ate really well during my pregnancy, but I was like, oh, I need to fix myself. Big time, big time, big time. So I'm even more
So I can
motivated.
be there and watch them grow up. And yeah, we didn't know so much. And not to throw shade on the dental world or the medical profession or anything like that, but we don't learn this in like dental school and medical school. Like they don't learn about airway health. And
Right,
there's nothing more important than breathing. Like it just makes complete sense. Like we can go 3 weeks without food, 3 days without water. We can't go 3 minutes without oxygen, right? So not breathing or not breathing properly affects every system of your body, and not sleeping as well. So it's pretty amazing that people don't get on the bandwagon. And we have like a lot of like fight back, and a lot of like the pediatricians, no, it's make believe, it's the world of make believe, it's just a money scam. And it makes
right,
me so upset because I see it every day. And studies we do are different because you can't do controlled studies with babies. Like you can't, like it's not ethical to do some of the studies that we would do for science, so to speak.
right.
So a lot of it is data based, and doctors, I'm sorry, I thought I had this on um
That's fine.
and it's kind of crazy because we'll get so much slack for it, and where it's so uninvasive compared to some of the things that they want to go in and do surgery and do this and do that and remove uvulas, and I'm like, oh my God, like, can't we just try and get people breathing first? And then if you need to do that, I'm not saying it's the reason and the answer to everything, but it's the answer to a lot of things.
Right.
And I feel like it's getting out there more and more and more, which is super exciting. Like you hear about it more, like the dentists have to ask you about how you sleep now. We never had to do that before. And who's in the mouth more than like the dental industry? Like we're
Right.
with people from the time they're maybe 1 or 2 years old until sometimes they're married and have their own kids, and then we have their kids. So we see that whole development process. So to not know what we're looking at. I mean, I'm not saying everybody should do myofunctional therapy or, expansion and like crazy things like, it's a lot of training and it's a lot of work. And it's a lot easier to go to a job and just clean teeth or do fill a filling or do a crown on a tooth and come out and go home. But you know, when you have the knowledge to at least refer, that's huge because you can save somebody's life.
Yeah, and
It's
my angle that I've taken with this is number one, I want the parent to be able to have that ability to observe their child and say, hey, I think even though I'm told by my pediatrician this isn't necessarily connected, it very well could be.
Mhm.
Or, so I've got X diagnosis at a year, 18 months, I got another one, 2.5, and down the road. Yeah, in the case of my nephew, you could have easily just done traditional orthodontics, pull out some tooth or whatever needed to happen, and then you would have no idea that it all had an origin and a simple, maybe not short or quick, but definitely a simple solution.
See, that's where it gets a little crazy because, you know, when my kids were growing up, so my kids are a lot older than Marcus's. So I have a 26-year-old and a 22-year-old. And when my kids were growing up, yeah, they pulled out teeth to fit everything, and it was all about aesthetics, right? We want
Yeah,
that beautiful smile and those beautiful white teeth, and it didn't matter what agents we were using to bleach, and everything was looking perfect. And what about space for breathing and the tongue? We never took that into consideration. But now that we know that, how do we practice the way we've been practicing those years ago? How is that okay?
right.
And you know, where is that line where we're really not treating patients properly anymore? Where is that ethical line? Just because, oh, I don't believe in that because I didn't learn it that way, doesn't give you the right as a healthcare professional not to learn and keep up with what's going on, right? So
Yeah.
it's a very rickety road.
Yeah, and dentists have one of the highest suicide rates in terms of the healthcare
Oh, is
sector.
that crazy? That's super crazy, right?
So there's something connected, right? That
There
there's
has to be. There has to be. Maybe it's that little space they work in all the time. I don't know. Hygienists didn't have that.
okay.
But yeah, it could. Who knows, right? Like who
Yeah,
actually knows? We know so many things about things at this point that we didn't. But it's our obligation to learn because we don't want to do harm for people. We always want to provide the best care. So if the muscles of the face are working properly, which is what I do, of course, fillings are going to last longer. You're not going to need braces 3 and 5 times because your teeth are shifting back. Like it's getting to those causative factors. You're going to be breathing through your nose, so your mouth's not going to be dry and you won't get periodontal disease as fast or get tons of cavities. Like everything is related. So to not look at the whole picture, to me, isn't really, I think that's unethical. Like, I don't think that's a great thing to
yeah,
be doing.
yeah. I remember I was eating mushrooms and there was a stone in the mushroom and I
Oh my
cracked it.
God, that's
And
toxic.
so I went into the dentist. Obviously, there was no pain, and it was really I'm just sharing the anecdote with
No,
you.
no, no, I appreciate it. I love stuff like
And
this.
they were like, well, you need a crown. It was a very tiny, tiny little crack, and they drilled maybe 80% of it off to give me a crown. And I was like, okay, obviously, when you don't know, you don't know. So, okay, we're doing this. How long is this going to last? And she's like, well, if you take good care of it,
What does that even
years.
mean?
But again, no explanation,
No.
no. And I was like, so just brush and floss. And she's like, yeah, just brush and floss. And I was like, but now that I'm like looking into this, I'm like, you
I
have
probably,
to tell
I
people a
probably shouldn't
little
have
more.
lost all that tooth surface before. Yeah.
Yeah, yeah. So let's start with a
Okay.
baby again. Well, I know, so in speaking with Dr. Liao, a lot of it is even preconception, conception, so that you have the proper formation of the oral cavity. So let's just start at breastfeeding because I think that it's a pain point for a lot of people. Um,
Okay.
I
So
know that, yeah.
go ahead. I'm sorry. I'm sorry. What were you
Oh
going to
no, I
ask
was
me?
gonna say I know that there's the issue with tongue tie. I think a couple of things of tongue tie, and I'd love your comment on it. I think it's overdiagnosed. I think it's a blanket. Everybody has tongue tie, and or because you have tongue tie, you immediately have to cut it. And so,
Okay. So
yeah,
I don't necessarily, I'll agree to disagree with that. Okay.
yeah,
So everybody has a frenum. So the string under your tongue, that's normal anatomy. Every single person has that, right? Hopefully every single person, unless they have a tongue tie release, right? So, and they still look like they have it because the anatomy heals pretty much the same way. So it's kind of neat. But that frenum, depending on the fascia and how it bundles, we're supposed to have this process called apoptosis where the cells die, and we're not supposed to have that tightness under there. So that frenum is actual normal anatomy until it's not. So what means it's not? So it's not will be that it's affecting your child's function or your function to work, for the muscles to work properly, or we're very symptomatic. So sometimes with a younger child, we'll have what looks like a tongue tie because it's tight, but they're breastfeeding okay, they're gaining weight, they're not getting a lot of air, there's no symptoms, they're sleeping, they're breathing through the nose. So those are the points where then that's just a frenum. That's not a tongue tie, okay? So it's really, really important that you have somebody that is educated in observing and doing a functional evaluation to look at what's going on, especially if you're symptomatic. And symptoms go from like A to Z on such a level. Sometimes that's even a hard thing to know what's affecting what. So, like on our website, we put like a self-assessment. So, because there's so many different symptoms that may be affected by what's going on. So, functionally, if you're functionally restricted, then it's a tie. Otherwise, it's a frenum. Okay, so when it comes to an infant, so I don't treat babies. So myofunctional therapy starts at age 4. You're
Okay.
supposed to be basically 4 years old where you can sit and follow a series of instructions, because it's a series of exercises that we have to do because we're retraining the neuromuscular patterns, right? So if we can't follow directions, or if we're really, really an immature 4-year-old, sometimes those kids aren't ready for therapy. And then I kind of feel like, do we want to kind of jump in and start like, getting them crazy and driving mom crazy and spending all kinds of money? We don't, right? But we always want to try and hit things at the earliest we can because we want to push that child into a healthier growth and development pattern instead of waiting to fix that broken child or that broken adult is where we come from, right? So with the babies, they're noticing a lot with the breastfeeding. But now when you're in the hospital and you're a new mom, first of all, not everybody should be doing a tongue tie release. No way, no how. I don't care if you have a laser, you have scissors. I don't care if you have a long fingernail. Not everybody should be doing a tongue tie release.
Right.
There is a lot of training that's involved in it. There's a lot of anatomy under the tongue that you need to know what you're doing, and just snipping or clipping that piece of string that's under there, your frenum, is not a tongue tie release. Okay, so many moms will come in with their 3 and 4-year-old, let's say at this point, and they had their baby, they weren't breastfeeding okay, they were having a lot of pain. Breastfeeding shouldn't hurt. So we can kind of ask back because we're looking for when things started and when things happened. So when we're doing our evaluation from my standpoint, and I'm seeing the 4-year-old, mom will be like, yeah, I couldn't breastfeed, or my milk wasn't coming in, or, and we all blame ourselves. As parents, we blame ourselves for everything.
Yeah.
It's not our fault. So when your baby's not latching properly, a lot of time the milk doesn't come the way it's supposed to. You don't start producing. Or what about women that are overproducers? I think I could have fed all of Melbourne. Like my breast like could have fed everybody. It was like ridiculous. So sometimes we're waterboarding our children and we don't even realize it. But their swallowing is not happening, but they're gaining weight. It's not hurting because it's coming out, but we never get that let down, and we never latch properly. And then we're like, I don't understand. I had no problems with breastfeeding. Well, there were other things going on that we didn't look for. So we shouldn't hear like clicking noises, and we shouldn't have a lot of air. And when they're very colicky and when those legs are tight all the time, there's other stuff going on.
Okay.
When one breast and they're turning their head, and one breast they do really well with, and the other one they can't switch. So these are the things that should kind of say, wait, red flag, red flag, red flag. Maybe I should talk to an IBCLC that knows what they're doing, or the pediatricians, not all of them do. So yeah, no shade again on the medical community, but they don't teach them stuff like this, right? So you want somebody that specializes and knows what they're doing. And if they're telling you, okay, I see a tongue restriction with your baby's not latching properly, I'll just snip it here. That's a warning sign. That's a red flag always. Even a baby needs some therapy before release. That fascia under the tongue, there's like a rubber band system under the tongue that's tight, and it goes all the way down to our toes. So that posture, the way they roll, the way they're curled, that tightness in a little infant can all come from that tightness under the tongue. So sometimes we need some body work. We need like a chiropractor that works with infants, or all these things are super important to get everything ready and that body and that nervous system relaxed. So when we do that release, we have the best possible outcome. So we'll have a lot of those women that had that tongue snipped for
No.
their babies when they were younger. And now they're coming to me and the child's not speaking okay. They're wetting the bed. They're not, there's a ton of symptoms, picky eating. Like there are so many things associated. And they'll be like, I don't understand it. We had a release. How could this even be happening? Because that release wasn't a real release. It was a clipping. So a tongue tie release gets rid of all that tightness and fascia under there. There's no such thing as a 98% release. We need 100% release. We need it to be done properly. We need exercises, stretches. Everything has to be done the way it has to be done for things to heal properly. So now I'll shut up so that you
No,
can
that's
actually.
okay. It's perfect. It's perfect. It's
Okay.
exactly what I want to hear. Yes. Yes.
Okay. Okay. So yeah. So by the time they're coming back with their kiddos, there's so many other things going on. So we should be watching. In a perfect world, our infant is supposed to have those little lips closed. If you pull open that little mouth, you should see that tongue sitting right up on the roof of the mouth. You should hear nothing. Our breathing should be silent through the nose. We are born obligate nasal breathers. We need to be breathing through our nose for our health in every aspect. And what ends up happening is if that tongue is low and we're hanging open, or that mouth is opening up and we see that mouth breathing, that starts a world of other problems. That changes the whole trajectory of growth moving forward. And we grow so much in the first couple of years. It's by the time we're 4, I think the craniofacial development, depending on what literature you read, because the percentages are a little bit different with everything, but almost up to 74% developed at 4 years old. We don't do orthodontics in the US till 10 and 11. So what are we doing? We're fixing that broken kiddo. So your tongue is an organ. It does so much for your body. So sitting up in the roof of your mouth, it's the architect for the development of your jaw. These muscles push that growth and development widen forward. So those teeth should come in beautiful. Everything should be lined up beautiful. That jaw development should grow wide forward and downward. When we're growing that way, then our lower jaw isn't locked behind it, and it can also grow. So when we have that tongue sitting low and not being that architect and not pushing that development forward, the jaw tends to grow tall and narrow, almost pointy like this. So remember, the bone, the roof of your mouth is the same bone as the bottom of your nose. So then we see those kiddos, we have a septum in here. If that keeps going this way, what happens to that septum, right? What happens to, think about the space that we have in the bottom of the nasal cavity. If we're narrow like this compared to this, we have so much more space. It's wonderful, right? Much more room for breathing. And if we have a jaw growing this way and the lower jaw is locked behind it, we take our airway that's supposed to be the size of a garden hose, we can make it into the size of a coffee stirrer. So now we're dealing with tiny space and we still have tongue growth. We still have our tongue in there. It still has to have room.
Yeah.
So there's your 6-foot tiger, 3-foot cage. There's those wonderful analogies that we don't have room for our car in our garage, and the only place for it to go is back. And there's our airway. Now our airway is compromised on top of it, and we just start to really, really pummel. So it goes downhill. It's like that snowball effect.
Yeah.
So one thing wrong starts to change the trajectory of everything until we start getting really symptomatic. And we hate seeing those kids on that struggle bus. It's awful. They
Yeah.
can't
And
sit.
yeah, I equate it to like, you go through all the trouble being pregnant, or if you're struggling to get pregnant, right? Which in my case, I
Yeah,
didn't.
yeah,
You struggle to get pregnant, then you're pregnant, and that's a struggle. It's, 9 months. And then all of a sudden, for me, when she told me just don't let it turn, I was like, my perfect child, there is something wrong with my child. I can't believe this. So I was determined to not allow that to happen. But I bring her up often because I want to shake my friend who has a 4-year-old with multiple cavities, clearly, impaired mouth syndrome, like the narrow airway, dark circles under his eyes. And I'm like, you don't have to believe me. I'm not the physician here. I'm not, but I'm telling you. And I feel like Oprah sometimes. I'm like, you have impaired mouth. You have impaired mouth. And you, and me, we all do.
it's all the way you kind of I don't know, maybe sometimes it's a little bit of explanation. There are parents, I mean, come on, we're all grown-ups.
Yeah.
There are parents that it's not my child. You know what I'm saying? And they're not, there's nothing wrong with my child. You can tell them A, B, C, you could show them A, B, and C. It's not like the world of make-believe. You can see when things aren't moving properly. When we do our functional evaluation, I like it because it's visual. So I like to do, especially the kiddos, I like to be really in person with if I can. I don't ever do like virtual care. I'll try not to be under 6 years old virtually, just because I like to engage and I like mom and dad to really see what's
Mhm.
going on. And sometimes it's harder online to do stuff like that. But watching, oh my God, why did my pediatrician see that? Like the look of horror when they actually see the tongue pulling and the little guitar string under there, all white, and why can't he lift it? This is why he can't lift it. This is what's going on, you know? So it's pretty amazing, but there's things to look for, you know? I mean, at 7 and 8 years old, your child shouldn't be wetting the bed. Signs of problems with thumb sucking and things going in the mouth is always our way of trying to get that proprioception for having that calm, relaxed feeling. When the tongue's sitting in the roof of the mouth, that triggers our vagus nerve, which is in the back of our palate back here, and that's our rest and digest. So there's lots of little warning signs. We shouldn't hear breathing at all. We shouldn't see their mouth open when we go in their room at night and we check on them. Grinding of the teeth. We used to think that was the body just getting ready to go to sleep and things. We'd put a night guard in, not to, that's our body's way of opening up our airway when we're sleeping. So those dark circles under the eyes, that's not normal. It's not just allergies. We have a vein right here that's superficial. When we breathe through our mouth, this is pretty cool because I learned this from Dr. Moralia, so I thought this was pretty amazing. So when we breathe, we have to build up carbon dioxide inside our body, even though that's what we exhale, because that's what helps, that's what makes us respirate. That's how we know that it's time to take our next breath, right? So think of the size of your nostrils compared to the size of your mouth. So when you breathe in and out of your mouth, you're letting go of a lot of carbon dioxide. Carbon dioxide is a vasodilator, which means it lets all the blood flow. So if the carbon dioxide is leaving, there's constriction in the blood vessels. And this vein under the eye is superficial as could be. So dark circles under the eyes are always signs of airway issues. Always, always, always. And the more we breathe through our mouth, the harder it becomes to breathe through our nose. Your brain is always protecting you. So it's kind of like it thinks you're over breathing. So it'll send a message to your goblet cells in your brain that produce mucus. And your nose will get more and more clogged. It'll be harder to breathe through your nose. So it's not like, okay, close your mouth, tape your mouth. All of a sudden, we'll start breathing through our nose. It's a process getting somebody to nasal breathe. And sometimes, and the reason I don't love mouth taping, especially in children, is we can't see what's going on back there. So if there's swollen adenoids, if there's swollen tonsils, like lingual tonsils that are all the way back there, if the turbinates are enlarged, if there's a deviated septum, and there is some physiological barrier to nasal breathing, taping a child's mouth is not safe. So we never want to do that without clearance from an ENT that nothing else is going on. And I'm not talking about where they look with their light. I mean a scope or a CBCT scan to really see what's happening. You never want to be mouth taping. We can train that body in a lot of different ways without having to tape that mouth closed. That is another Band-Aid. We shouldn't have to do that.
Right, right. Yeah, I learned from Dr. Stagg, the elimination, the allergy elimination.
Super important.
Yeah, I'm just learning it for myself as well. So I was told by an allergist, never ever get a dog. And I married someone with a dog, and I'm paying the price for that now. And that's okay. Like,
I
I
have
love it.
two. I have two, and I have to be honest. You're breathing through your nose, right? So you're filtering out a lot of those allergens. So the more you nasal breathe, the less allergies you're going to usually
Okay.
have. Okay, because your little cilia, those little hairs in your nose, kind of filter all that air that's going in. So you're always going to see more allergies in somebody who's mouth breathing because you're not filtering that air. So it's a little bit different. So there's little tricks, but yeah, you don't want to sleep in the room with the animals like that. Dander, it's
Take them out.
dander, dust, and dairy. Those are your three, inflammatory. And when parents are saying there's a lot of allergies or there's a lot of congestion, we want to eliminate those things first. That's usually the three things that we start with. And then, if we need allergy testing, sometimes we do. Nasal hygiene, again, also something really, really important. So your body gets dirty, so does inside your nose. So keeping those airways nice and clear with something natural, not like 800 pounds of steroidal Flonase. We don't want to be
Right,
using that,
right.
right?
The
That's not something,
acronym.
and give it out like it's water. Like the aunties will be like, "Oh, take Flonase," and I'll have parents come in and be like, "They've been on Flonase for like 3 years, and it's not helping." And yeah, and
No.
and you put drug in your baby's body that you don't really want to be doing. So like a xylitol rinse or something like Xlear, something to just promote opening up those airways, or some essential oils, or just things to really enhance and help you breathe through your nose more and keep that all open. It's helpful. Sometimes just getting that going first can also eliminate allergies. We blow, squirt, blow again, and we do that in the morning and the night, and it kind of helps a lot because you're cleaning out all that stuff.
And then
So
in the
that's
case, yeah, go ahead.
no, that was that I want to hear what you had.
No, I was going to say in the case of an adult, for example, who is, again, just to be direct, my husband is in much worse shape than I am. And I've
Okay.
realized just by learning everything, I'm like, you've got bigger problems than me. And so I ordered him some mastic gum because on top
Okay.
of it all, he has the poor jaw formation. And so I'm just curious. So I want to say that it's ironic that Hollywood and all these things, what they do is imitate health. Like you have a beautiful mane of hair and your skin is glowing and your pearly white teeth. And I'm just like, don't we see as a society, it's all
It
made to
wasn't
look
make
like they're healthy,
sense.
but they're not, they could or they couldn't be. Yeah. So I mean, I guess, yeah, you got to get the airway assessment. You have to fix that first. And then the rest will
Have
kind of
to
take
breathe
place.
before you do anything else.
Yeah.
So breathing, you have to be able to breathe through your nose for proper sleep. So that's the other part of the equation, even with your tongue. So we were talking about tongue ties, right?
Yeah.
So when we sleep in 4 stages of sleep, right? So the first stage is falling asleep. Falling asleep when it's taking over an hour every night to fall asleep. I know my whole group of friends, we're all in that changes of life kind of part. So everybody blames their hormones for everything. It's our hormones, it's our hormones. We can't sleep anymore. But is it? So you have to kind of look at the whole picture, right? So yes, life is hard, but it shouldn't really take us more than about 10 or 15 minutes to fall asleep. So I don't ever judge anything, or I don't judge anything anyway, but I don't make a mental red flag to myself if somebody tells me that they have a few nights a week that it's hard to fall asleep, unless someone's telling me they're chronically like insomnia, they can't sleep till 3 o'clock in the morning, then that'll be a red flag for me. Then there's the second phase of sleep, which is light sleep. So light sleep, we're supposed to spend 50 to 60% of our night in light sleep. In light sleep, you can move your body. So you can beat up your husband, you can move your pillow, you can turn your blanket. Sometimes I feel like I'm even thinking when I'm even sleeping. I know I'm sleeping, but my brain's still going. Grinding our teeth. Any movement is done in light sleep. Then we go into deep and REM sleep. And deep sleep was supposed to be in 20%, about 20%, and REM sleep 25%. So REM is your dreams. Deep sleep's that we can't wake you up, you're really out cold. And they happen in different stages all through the night. Okay. We need to be in them for those specific stages. So our body's made to do that. Why wouldn't it just do that? Right. I mean, why aren't we sleeping properly? So when your tongue is in that roof of the mouth and it's suctioned up there the way it's supposed to be, lips are closed, we're breathing through your nose. That's your on switch for nasal breathing. You're going to go through all your cycles, wonderful, spectacular. We're not going to have any problems. However, when our tongue is down, and it's work to keep our mouth closed all day long, we don't even realize it because we compensate. We're able to, our body will compensate. Maybe our head posture is a little forward. Something will happen that we'll be able to breathe through our nose, even though our tongue is lower. At nighttime, your body's not working like that. So when you start to go into that deep and REM sleep, everything relaxes. Your jaw relaxes and automatically falls back a little bit. Now, if the tongue is sitting down here, well, where's it going? It's going to relax as well. And it doesn't kind of block your airway. I feel like that's kind of a misconception. The way it's described is it causes a negative pressure in the airway, causes the airway to collapse. And as that airway collapses, now your brain that is in REM and deep sleep, those are the 2 stages that it's like automatic pilot. There's no more movement. Your brain's just in recharge. It's getting your body ready for tomorrow. And
Yeah.
now all of a sudden, you're not breathing okay. And now your brain has to be like, oh, I got to get out of this phase. I have to go back into light sleep because I have to move this tongue out of the way. And every time it has to wake you, those micro arousals, in order to do that, it has to put your body into fight or flight. So what happens when you're scared? Your heart rate goes up, your blood pressure goes up, your adrenaline starts pumping, your cortisol levels go up. Kind of coincidental that we have all these ADHD diagnoses all over the place, all of a sudden that we didn't have years ago when my kids were growing up. I didn't see ADHD diagnosed like this. Now everybody has ADHD. You can't
Yeah.
focus, you can't concentrate, right? The same 6 symptoms of sleep disorder breathing are the same symptoms of ADHD. And those check boxes just go and we just kind of medicate. We don't look at all the whole picture, right? So for an adult, if that adrenaline's pumping all night long, maybe you can sit still. You're not going to be as fidgety and moving and crazy, but a kiddo, where are they putting that? So you have a 4 or 5-year-old, they're darting off the walls until they crash, until it's just crash out time at night, until tomorrow happens all over again, but they're never resting. So on top of that, for an adult or a child, if that heart rate's going up and all of that blood is pumping, your kidneys are working more. So we have our bedwetters, right? Your kidneys have to filter more blood. As that blood's going, all of a sudden we're wetting the bed at 10, 12 years old. Kind of all of a sudden, ding, 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 what's going on, right? Maybe there's a sleep issue here. So these are things to think about as a parent. Like these are things that we make excuses as parents for everything. I do it for my kids now and they're older. I make an excuse for everything. But the bottom line is we're just making excuses for everything because that's not the way it's supposed to be. So yeah, my 12-year-old's still wetting the bed, but it only happens once a month. Okay. That shouldn't be happening, right? So if
Right.
we know there's a medical problem, what else is going on? Let's look at another picture. So when we're younger, and the reason a sleep study is a little bit like this. So sleep study is important so that we can see how oxygen levels are changing. We look at an AHI score, which is how many times your oxygen stops or your oxygen starts dropping for a period of time. And every time those things happen, it's called an apnea or hypopnea index. And how many times an hour that happens designates whether you have sleep apnea or not. 1 time in an hour in a child means they have sleep apnea. 5 in an adult means that they have sleep apnea. So it's 5 times an hour. So if I sleep 8 hours and it happens to me 4 times, and 28 times doesn't mean I have sleep apnea. I'm fine. But that extra time and now all of a sudden I can get a CPAP machine. So it's so insurancy. It's a little bit scary, right? Because we know that that's not healthy either. That adrenaline, that blood pressure, that heart pumping more. So when we're looking at somebody who's younger or healthy or in shape or like little kids, what happens is when that oxygen starts to change at all, before we'll see big drops, the heart says, I'm young. I'm just going to beat a little faster. I'll make a little more oxygen. No worries. I got this. And we don't always see those oxygen level changes. We have to look at the whole sleep study because all parents tell me they don't have sleep apnea. They had like 0.8 instead of 1. I don't know how that's okay, but that makes it okay. So the doctor won't do anything with 0.8, but their pulse was like this all night and their heart rate was like this all night. And we need to not look at just A, we need to look at A through E because that's the sleep study. That's the whole picture. So when we're younger, if the heart's making more oxygen, we're never going to see those O2 levels drop. Even in healthy adults, especially in women like in their 20s in shape, we may not see those oxygen changes. That doesn't mean they don't have upper airway resistance, that they don't have issues that are going on. It just hasn't gotten to the point where those oxygen levels are changing yet. And then all of a sudden, we start getting a little older. The heart's like, I'm done. I'm not doing this anymore. And now all of a sudden our O2 levels are dropping and we're like, where did this come from? Why do I have sleep apnea? I was fine. And we were never fine. We were always dealing with something. We just didn't realize it because we didn't look at the whole picture.
I find also part of me looking into all of this, I came to the conclusion, I was like, who do I know that's radiantly glowing? Like overall, and it's less than 5 people that are completely glowing, that they're doing great, that they're, kicking ass and they're, just living life to the best. And I was like, no, I signed up to have kids that are healthy. And so if I have to drive an hour and a half to take them to the AMD, I will.
Right.
And if I have to, which I've done, if I have to cut off certain things for my husband, like no more, no more Friday night margaritas for you. I'll do it. I'll do it. If I have to be bod cap, I will. But I feel like as a society, because it's so common, we think it's normal and it's not. It's
It's
absolutely
not.
not. It's
We
not.
get so good at compensating that we never realize we've been compensating until we get sick. And then we just think it's genes. My parents had high blood pressure. My mom has thyroid disease, but is that really what's going on? I mean, both my parents have periodontal disease. I'm a dental hygienist. I've been flossing my teeth since I'm like 2, I feel like at this point, right? So I don't have gum disease. I have a predisposition to it. You may have a predisposition to it, but is that the only factor? So there's a lot of pieces to the puzzle. There's no one answer, but I feel like this is an easy thing to look at.
Absolutely.
And I think the other big issue for parents, which is what's really upsetting for me, is I could have somebody in here. We'll do a functional evaluation. So our evaluations are long. We're together for like an hour and a half. We have a lot to talk about. The kids are usually playing and doing their thing until they're not, until we have to really look at everything. We'll be like, we heard you have a superhero tongue. We want to see how superhero it is. So we keep it really light and fun, but in the same breath, we need to see what's going on, right? And we'll go through this whole thing with mom and dad. They'll see everything, they'll understand everything. We have 90 symptoms going on, and they'll go to the pediatrician, and the pediatrician tells them it's a crock of crap, they'll grow out of it. And mom, it's a lot of easier of an answer, right? So, okay, well, my pediatrician said that I don't have to worry about it. And then I'm like, oh my God, because my heart goes in my throat, not because of the case, not because of the money, not for no other reason that I just met that baby and that baby's struggling. And now I can't get that out of my mind. And
Ah,
I'm not a parent. So what do I do? There's nothing I can do. I can try and send some literature. I can try and educate mom and dad a little bit more. But when you get the answer you want to hear, when you search long enough, one person is going to finally tell you, no, that's not it. And if that's what you're looking to hear, that's what you're going to hear.
yeah.
So
I
I
tell,
really see the point.
I think it all the time. Like you can either surround yourself by a group of people that are challenging you in a constructive way. And that's kind of been my struggle. Like I want to find more friends that are like, hey girl, I just read this book, or I just did this, or I just
Yeah, you
followed this
should see this.
person.
This is
Like,
great. You might want to look at it. I mean, not pushing agenda, but just kind of, this might really open your eyes up a little bit.
yeah,
I
or
have
I mean, what's the alternative to that? I just find a group of girlfriends where we all just tell each other, "Oh, that's okay. That's my child has the same problem."
my
That
child, that's it. Don't worry, they'll grow out of it.
no,
But do
I don't want that. Yeah.
we compensate. We compensate and we get really good at compensating. And those compensations, there's there's accountability on some level. Something is not going to be okay after a while. If your car's oil isn't in there and you keep letting that happen, eventually that engine's going to break down. It's the same with your body. So I kind of feel like it's a big common sense factor when it comes to adults, right? Um, and it's symptoms that drive us. And usually by the time I'm seeing a lot of these kiddos, mom and dad are just like, please help me. I don't know what else to do. I've done 55,000 things and here we are. And
Yeah.
then we're like, okay, well, did we look at this? Do you see what's going on here? And then it's like they'll cry because someone's finally listening. Someone's finally, yes, this is what's going on. So let's have this doctor look at this because this doctor knows what they're looking at and make sure, because this is my observation and I can't technically diagnose. So we're going to send you to the professional that you have to be at this point, and let's get this taken care of for your child. So what about kids that are in speech for like 6 years and they still speak the same way? And they'll come in and the tip of the tongue is like stuck to the bottom of the mouth. How do you make a sound if your tongue doesn't move? And they've learned to talk. So look at that rock star right there. And I'll tell them, you are a rock star. You are eating, sleeping, not well, but you're doing it. So super cool, right? But it's very validating because you know your child better than anybody. So don't just take anyone's answer. If you feel like something's wrong, you're a mom, there's something wrong. You investigate, look deep, dig deeper is all I can say to parents because there's so much mixed information, but there's a lot of good information. Like Alabama Tongue Tie has like an entire website. Dr. Baxter wrote the book Tongue Tie, and he educates, he does like 3 seminars, I think, online where showing them that how easy it is. I mean, it's not a haircut. So nobody wants to do surgery on their child if they don't have to do it. So that's why it's important to have a functional evaluation before you do something like that. but he's got so much information out there. And there's links to so many studies and so much data. So these are the people that we need you to be looking at, not the New York Times that writes like this chop article.
Yeah.
Like, did you see that article? So
Uh-huh.
I'm New York originally, I told you, right?
Yeah.
So they just wrote this chop article. I work with the most incredible surgeon in New York, Dr. Scott Siegel. He is one of the most amazing souls that you've ever met in your life, and he's brilliant. And he let them in his office and he showed them what he was doing, and he hours of like just time and spending time to, wow, we can get this out there, we can educate, some parents are going to learn, we're going to save another life by doing this. And they made it into this chopped mess of like cutting babies' tongues for money. Like, it was the most disgusting article I've ever read in my whole life. I just cried. Like, I cried for him. Like, I couldn't even, like, it just it broke my heart, because they'll be the parent that will walk away from this because they'll read that and they'll believe that.
Yeah.
And that child will suffer forever because of that. And that kills me. It absolutely kills me. There's just no there's no accountability for the media. It's
I mean, the
really, really.
Times has been doing that for a while. I want to
So
say
if
the first,
anyone's seen that article, it's
yeah,
garbage. Dig deeper, dig deeper. That's what I'm going to
I
say.
remember it was maybe 2005, 2006. They were like, okay, we're gonna get to the bottom of these factory farms, and they gave everyone 3 days notice. By the way, we're gonna stop by and we're gonna investigate your facilities. And I was just like, okay, I'm done with the Times. They'll never get to the bottom of anything.
No,
Um,
absolutely not.
so
It's you have
yeah,
to wonder like what's fueling all of it. And like, does Big Pharma really want us to get all these kids off ADHD medication? Probably not. Do the formula companies really want women really breastfeeding again? And I mean, mom will try, she'll have pain, doc will be like, just give it a bottle, don't worry about it. Right? Really? But we know our breast milk is the best thing. And then mom feels like a failure and she feels awful. We blame ourselves as parents, and it's not mom's fault.
and let's
It's
put her
definitely.
on some antidepressants.
Yeah, exactly. Right. That's the next. I mean, I've read some people's journeys that are gut wrenching, because
Yeah,
they really beat them and they know something's wrong. And the doctors are like, nothing's wrong. I'm telling you, nothing's wrong. And there was something wrong.
yeah,
Trust your gut. As a parent, trust your gut. That
beautiful.
mommy instinct is really important.
Yeah. I refused to do the tongue tie with her. And it's funny because I gave it, I was like, we're gonna give this a year, we're gonna go see craniosacral, we're gonna do an osteopathic adjustment. I was like, we're gonna figure it out. And by the time she saw the osteopath, she's like, oh, it's so slight, it's so slight. I should be like another session or two and we'll do some releasing. And I was like, okay, I didn't have to go through
Right. Of course. Who wants to put
because
their
it
baby?
wasn't right for her. Because, in her specific case, she didn't need it. I mean, I didn't want to cut her. Like I didn't want to go through that.
Yeah,
But I
no.
also, yeah, that just to your point of the follow your gut, follow your intuition. Had I not seen improvements, I would be like, okay, maybe we do need to do this. But because
Remember,
I
we
saw them,
need to be symptomatic in
right,
order for it to be a tie, right? So, is that floor of the mouth lifting? There's like easy kind of things to look for. So if your child has to, or yourself, if you have to close your mouth more than halfway to get that tongue to the spot right behind your front teeth,
mm,
chances are something's restricted. If we take our finger and we hold the floor of the mouth down, and you have to really close your mouth, you can't lift that tongue at all, chances are you have now is the new, it's not a posterior tongue tie anymore. They've just changed the whole verbiage for it. Now it's mid tongue restriction, because technically, even though this is the back of the tongue is really way down here. So now this piece back here where that's supposed to be up is really the middle of the tongue. So it still has to be suctioned like this, but we don't have to fight with the ENTs anymore, because yes, the posterior part of the tongue is down. Correct. It's supposed to be down. So it's all the way you word things, like it's kind of crazy. But these are important things. And if you feel like something's not right with your child, keep going. You'll get to the bottom of it.
okay, so some parting words of wisdom. If you had somebody's ear with a newborn or you see an adult, what would you love to be the main takeaway for someone who's maybe hearing you for the first time?
So the most important thing in life is breathing. So if your baby's making noise, breathing, your child, your husband, breathing should always be silent, mouth closed through the nose. So if we see anything else, investigate. And that's the best place to start.
Lovely. I have to thank your husband for sharing you with me.
My pleasure. It's my pleasure. I hope like even if one person, if it helps one person, then it was worth everything that you're doing right now. You know what
Oh
I'm
yeah,
saying?
yeah.
So
I
yeah,
feel like
it's
the Lorax, you know. Hey, fix your breathing. Hey, I gotta fix one.
keep putting it out there and you know, people are looking for stuff. People are listening, people are watching. I mean, you know, look at the Instagram accounts and how they're growing. We try and put so much information out there. So we were so excited. We just hit 10,000 followers. I was like,
That's
oh,
awesome.
it's great because we keep putting info out and we want to educate and ask us questions. We don't we'll answer anything. We don't care. We're not, you know, we're not trying to suck you in. We want to help. We really want to help.
Yeah, I
Everybody in
believe it.
the field is probably on their own journey with their own kids or somebody that they love at some point. So you'll find the most amazing people doing this from their heart. And I feel like that's what it's all about. It's all about us working together, right?
Yeah, yeah. And you
So
guys don't, in general, there's no like, here's a pill for that, here's the surgery for this.
if
And
there's a
that's,
pill for that, and there's no easy fix, like, right? I always try and
mm,
tell my kids, you know, it's hard work. Anything worthwhile is sometimes hard work, right?
yeah,
And even nasal breathing isn't easy. Look, yeah, the athletes that you're seeing in the paper that are taping their lips when they're training. Like, you know, everybody's trying to get on board. So I'm hoping as time goes on. I mean, now look, dentists have to ask about your sleep. We never had to do that before, and that's the new ADA, right? They have to every dentist has to ask you. So it's got to be all moving in that direction,
right.
and that's the direction we need to move in. We need to be off all these meds and look for our root causes.
Yes. Beautiful.
Yes,
Lovely.
thank you for having.
Yes, yes.
So awesome,
All
super
right.
awesome.
I love learning out. I'm like, yay.
Super cool.
Definitely. All right. So, should I send you the video when it's edited?
Yeah, sure. I'd
Okay.
love to see it. I'll
Yeah.
stick it up on the website too. That would
Okay.
be fun.
I'm about a month out. I mean, in terms of when you go to post it. Okay.
I
Perfect.
mean, my partner does a podcast with the doctors.
Cool.
I spy with my Myo eye, but it might be really good for you to take a look at because there's so many different from lactation consultants to body workers to Dr. Ben's on there, Dr. Siegel's on there. Like there's so many great professionals, and there's lots of information out there. But that's great. The more, the better. Just keep
Yeah.
learning. That's the way to
I found Airway Palooza and I was like,
yeah,
oh,
I'm going. I
I
can't wait.
go.
March 16th, 17th, and 18th, I think it is. It's St. Patrick's weekend.
That's
But
so fun.
that's going to be wonderful. It's a great group
Oh
of
yeah. I have a question. Like, so what for you is cutting edge? Like, what are you excited right now? What are you looking forward to? You know, what's like, oh yeah, that keeps me up with excitement.
so actually, I work with a doctor in Huntington in New York who is going to be the first doctor in the US to be working with Invisalign expansion,
Okay.
which is pretty amazing. So I'm like super excited. I'm actually seeing her at there's another conference in Long Island for the New York Pediatric Airway
Yeah.
Association of New York. I don't know. There's so many letters. I
Yeah,
always
yeah,
screw
yeah.
it up, but it's called PANI, and that conference is in the end of April. And I'm excited to meet with her because she's going to be the first doctor doing that. And I work with her, and it's super exciting. So I love all the new appliances and to see what's working best for people and what's giving us the best results. I love working with Dr. Stagg. Like she's one of the only ALF providers I know. That ALF appliance is amazing. So there's good appliances. There's a lot of good appliances.
Right, right.
So finding your care provider that is the best at what they're doing and gets the results is where you want to go. So people always ask me, is this appliance better than this? Or is this, it's your doctor, what your doctor thinks is best for your body and what's going to work best for you and compliance, right? It's a lot of compliance. So, but that's what I'm excited about. That's one of the things I'm excited about. And I'm excited for all the conferences. I love keeping up with everything and learning with all these great people that just their heart is just so out there just to help everybody. It's
Yeah.
awesome.
Yeah. Shout out to Dr. Stagg. She's incredible. She's
She's
incredible. She's a
amazing.
beast,
Love
and I
her.
mean that in the best way and like the most polite. Yeah. I
Yeah,
said she's a beast. Yeah, yeah, yeah.
she's had a lot to contend with, you know. They
Yes.
fight her tooth and nail, and she's brilliant. She's absolutely brilliant. And I'm so excited. Her new book is coming out. I'm throwing
Yes.
props out there too. Yeah, and that's gonna be amazing. There's lots of good stuff, and that's what's calling me right now. That's so funny.
Tell her you're done with me. Tell her I said hi.
I will. That's awesome. That's absolutely awesome.
All right.
And my
Okay.
partner's pregnant with twins, which is really, really exciting. So
Her first.
lots of good things happening. I'm glad this is a month out because she hasn't told anybody yet. She's going to kill me. I'm
I'll
like,
keep
oh
it a secret.
my God.
Okay,
I'm
Joy.
excited. It was so nice to meet
My
you. And thank you.
pleasure. Take
Take
care.
care.
Yeah.
Bye.
Bye.